Medical conditions and illnesses can suddenly trigger an unexpected medical emergency.
Good morning, Rick. How are you? Whoa, are you okay?
I don't know. All of a sudden, I just feel awful.
Okay, well, I can help. Is that okay? Tell me more about what...
In general, suspect a serious illness when, without warning, a person suddenly appears weak, ill, or in severe pain. In many cases, the human body displays warning signs to alert us to serious illness. The most common warning signs of serious illness are an altered mental status, breathing difficulty or shortness of breath, and pain, severe pressure, or discomfort in the chest.
Carl, are you okay? Let me help you, okay?
Caused by a number of medical conditions, as well as the use of alcohol, medications, or drugs, an altered mental status is a significant or unusual change in a person's personality, behavior, or consciousness. It is an indication of a change in brain function.
Carl, do you know what's going on?
Regardless of the cause, an altered mental status is a warning sign of a serious problem and is considered a medical emergency. Activate EMS.
Outside parking lot. I need EMS right away. And can you send somebody out with first aid kit?
Position the person for comfort. Calm and reassure him as best you can. If responsiveness becomes severely diminished, consider placing in a recovery position to protect the airway. Reassess regularly. The condition could deteriorate quickly and require additional care.
Hey, are you ready to get something to eat?
Yeah, I'm not having much luck with finding what I need.
Whoa.
Fainting is a momentary loss of consciousness caused by an unexpected drop in blood pressure and blood flow to the brain. Anxiety, fear, pain, stress, standing in place too long, or rapid movements in position, such as standing up quickly from a seated or lying position, can all result in someone feeling faint or fainting. A medication or underlying medical condition might also contribute to the cause. If someone complains of suddenly feeling warm, lightheaded, or that his or her vision is narrowing, quickly lie her flat on her back on the ground. You can elevate the feet about 6 to 12 inches, which allows blood from the legs to move back into the body. Do not elevate the feet if it causes pain or you suspect a person may be injured. This is a temporary condition that should pass quickly and allow the person to get back to normal activities.
A stroke, or brain attack, occurs when the blood supply to a portion of the brain is suddenly interrupted.
Somebody, we need help. Sir? Madam? I'm Ellen and I work for the winery. Is something wrong? I don't know what happened to him. I can help.
A stroke most commonly occurs when a blood clot obstructs a blood vessel in the brain. A stroke can also occur when a weak spot in a blood vessel wall, known as an aneurysm, bursts open and bleeds into surrounding brain tissue. Signs of a stroke can vary depending on where the damage is located. The signs tend to show up suddenly. Numbness or weakness of the face, arm, or leg, especially on one side of the body. Confusion. A change in the ability to speak or understand. Changes in sight and balance. A severe, sudden headache. Early bystander recognition, along with rapid transport to a hospital, is critical for limiting damage or even survival. Medications are available at hospitals that can limit the severity of a stroke. The earlier they can be given, the better. A simple stroke assessment, such as FAST or FAST, helps decrease the time it takes to suspect a stroke, activate EMS, and get a person treated in a hospital.
Sir, can you try and do a few things for me?
F.
Okay.
Face droop.
Smile for me?
Ask the person to smile.
If you can.
Look to see if the smile is uneven.
Good. Now, can you raise both of your arms?
A. Arm drift. Ask the person to raise both arms. Look to see if one drifts back down.
Can you tell me your name?
S. Speech difficulty. Ask the person to speak a simple sentence. Listen for slurring or difficulty. T.
I think we need
Time to activate EMS.
Troy, go call 911.
If the person has trouble with any of these tasks, activate EMS immediately. Report the time the person was last seen normal to EMS personnel. Overall, do not give anything to eat or drink. Be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED. Stay close, calm, comfort, and reassure the person until another provider or EMS personnel take over. Diabetes is a disease in which the body cannot effectively use sugar for energy. Hypoglycemia, or low blood sugar, is a diabetic condition that can rapidly develop and become life-threatening. Early recognition and treatment by a first aid provider can prevent the condition from worsening.
Hey, are you okay?
No. I need to get started on this. I'm not sure how.
Suspect hypoglycemia with anyone who begins to act oddly or becomes confused. The person may be trembling or shaking, and his skin may be pale, cool, and sweaty. If the person is unable to communicate clearly, look for a medical alert bracelet or necklace, which may help identify the underlying condition. You can also check with others about the person's medical history or medications he may be taking. If someone is unresponsive, unable to follow simple commands, or has difficulty swallowing, quickly activate EMS and provide any required supportive care. Do not give anything to eat or drink.
Hey, Anna, can you come over here? Do you have your glucose with you?
My coat.
What's up?
I think Jerry's having a problem with his diabetes. Can you run to the break room and grab his coat? He has some sugar tablets in one of the pockets.
If the person is responsive and can swallow without difficulty, give about 15 to 20 grams of oral glucose tablets if they are available. If not available, use something with dietary sugar instead, such as orange juice, candy, fruit leather, or whole milk. Things that use artificial sweeteners will not help. It is important to note that insulin is not considered an emergency medication. It is never appropriate to administer insulin to a diabetic person in an emergency setting. Calm, comfort, and reassure the person. If he responds to the sugar, his mental status will gradually improve. If there is no response to sugar within 10 to 15 minutes, or the condition worsens, activate EMS and provide additional glucose or sugar. Reassess regularly until another provider or EMS personnel take over.
Eduardo?
Generalized seizures are triggered by excessive electrical activity within the brain. The
Eduardo!
result is uncontrolled muscle convulsions throughout the body.
Hey! Somebody help! Help!
Typically, seizures happen without warning. Jerking movements of the body occur and breathing may seem absent. The person can lose control of his bowel or bladder and may vomit.
I can help.
While there are many things that can cause a seizure to occur, the care provided is always the same. Protect the person from injury during the seizure. Move objects away that he may bump into. Do not restrain the person. Allow the seizure to take its course. If possible, roll the person onto his side to allow saliva to drain from the mouth. Do not put anything in the mouth, including your finger. There is no danger of the tongue being swallowed.
Has he had a seizure before?
I don't think so.
Go call for EMS and get the first aid kit and AED from the break room.
Activate EMS if the person is injured or vomits during the seizure, has no history of seizure, has multiple seizures, or continues to seize for more than 5 minutes. Most seizures last only a short time and will stop without any special treatment. Once stopped, place the person in the recovery position to protect the airway. If responsiveness and breathing are absent after a seizure stops, begin CPR and use an AED if one is available. Normally, once a seizure stops, responsiveness improves slowly over time. Provide continual reassurance as the person improves. Provide privacy to minimize embarrassment. Continue to monitor until EMS personnel take over care or the person returns to normal.